Listen very carefully, because what I'm about to explain could save you a lot of stress, time, and frustration down the road. This is one of those Social Security updates that sounds technical at first, but it directly affects how fast you get help when something goes wrong. If you or someone you care about receives Social Security, SSI, disability, or Medicare-related support, this matters to you. And before we get into it, do me a quick favor right now. If you want clear, calm updates like this that actually explain what's happening and what it means for real people, hit that subscribe button and turn on notifications. Subscribing really helps the channel grow, and it makes sure you don't miss important changes like this one. Starting March 7th, Social Security is rolling out a major internal shift that changes how cases are handled, how appointments are scheduled, and how workloads are assigned behind the scenes. This is not just a minor tweak. It's a structural change to how the agency operates day to day. If you don't understand how these pieces overlap, you could run into longer wait times, mixed messages, or extra confusion when you're trying to fix a problem or get answers. Some parts of this change could improve service in the long run, but during the transition, especially if you're dealing with disability, SSI, or a complicated issue, things may feel uneven. Let me ask you something real quick, and I genuinely want to hear from you. Have you ever had to call Social Security, visit a field office, or deal with a caseworker, even just once? If you have, you already know how stressful that experience can be. Drop a comment and let me know how it went, because those real-life experiences are what matter most as these changes roll out. For decades, Social Security operated in a mostly local way. You had a field office assigned to your area, and that office primarily handled cases for people living nearby. The staff there were familiar with state-specific rules, local SSI supplements, and how federal Social Security programs interacted with state programs where you live. In many ways, each field office functioned like its own small ecosystem. When you walked in or called, you were dealing with people who worked on cases just like yours every single day. Starting March 7th, that model changes. Social Security is moving toward a national workload system paired with a national appointment scheduling system. What that means in plain language is this. Instead of your local office mainly working on local cases, offices will begin handling cases from anywhere in the country. If one office is overloaded and another has available staff, work can be shifted nationally instead of sitting in a local backlog. On paper, this sounds efficient. Social Security says the goal is to reduce delays, balance workloads, and make better use of limited staff. And to be clear, field offices are not disappearing. You can still go in person, and those offices will still serve as the front line for the public. But behind the scenes, the actual processing of claims, corrections, and follow-ups is becoming more centralized. This is where concerns start to come in, because this change is not happening in isolation. Over the past year, the Social Security Administration has gone through major upheaval. Roughly 12% of the workforce is gone. That's about 7,000 positions. Some regional offices have closed. Leadership has shifted. Phone systems were overhauled. At the same time, beneficiaries are being pushed more aggressively toward online services. Even though many seniors, disabled individuals, and low-income recipients struggle with internet access or digital tools. So, when Social Security says this national system will help them manage work more efficiently, critics are asking a very fair question. Is this true modernization, or is this a way to cope with having fewer staff? Even before these staffing losses, Social Security was struggling with backlogs. Disability claims often took many months, sometimes more than a year. SSI cases are notoriously complex. Phone wait times were, for years, painfully long. Technology can help, but it cannot fully replace experienced people, especially in a system as complicated as Social Security. Another major concern is the loss of local knowledge. Social Security programs do not operate exactly the same way in every state. Some states offer supplemental payments, others have different Medicaid coordination rules. Eligibility details can hinge on state-specific policies. When cases are handled nationally, staff may not have the same familiarity with those local nuances. That does not mean mistakes will definitely happen, but it does mean the margin for error can increase during a transition like this, especially if training is rushed or employees are stretched thin. And training is a huge piece of this puzzle. Employees now have to learn new systems, new workflows, and handle cases from states they may never have worked with before. That learning curve takes time. During that period, service can feel inconsistent. Some people may notice faster responses. Others may feel like the process is slower or less personal than what they experienced before. To be fair, there are real improvements that Social Security points to, and it's important to acknowledge them. Over the past year, the agency reports that it has answered significantly more phone calls than before. Average hold times on the main number have dropped into the single digits, which is a major improvement compared to the 20-minute waits many people were used to. More calls are being handled through callbacks and self-service tools, although I still hear from plenty of people who say those callbacks can take longer than expected. Under current leadership, there has been a strong push toward using data, performance metrics, and technology to improve outcomes. The Social Security website now operates around the clock. Disability backlogs have come down compared to where they were at their worst. Processing times have improved somewhat, and inspectors have reviewed the data and confirmed those improvements are real. So yes, progress is happening. The agency is not standing still. But here's the tension. Social Security serves around 75 million people. That is an enormous responsibility. When you combine fewer staff, brand new systems, and a national workload model, the transition period can be bumpy for real people with real needs, and that's where awareness becomes critical. Let me be very clear about what this change does not do. Your Social Security check is not being cut because of this. Your payment date is not changing. Eligibility rules are not being rewritten on March 7th. If you're already receiving benefits, those benefits continue. What may change, at least temporarily, is how easy it is to get help when something goes wrong. Issues like correcting an overpayment notice, fixing a Medicare enrollment problem linked to Social Security, resolving an SSI eligibility question, or following up on a disability claim are the areas where people may notice differences. This is not about panic. This is about preparation. Knowing the system is changing helps you stay patient and proactive if things feel different for a while. One of the most practical tips I can share is this: keep good records. Save every letter. Write down the name of anyone you speak to and the date. Keep copies of documents you submit. These habits always matter, but they matter even more during periods of transition. If you're comfortable using online accounts, that can help too, because those systems are becoming more central to how Social Security operates. At the same time, if you rely on in-person help, those offices are still there. Social Security has said clearly that field offices remain the front line. The shift is mostly about how work is assigned and processed behind the scenes. This change is also part of a broader trend across government agencies. The IRS is going through similar transitions, especially with refunds expected to be higher this year due to new tax provisions. The idea is that technology combined with centralized workflows can improve service without constantly adding staff. Supporters say this is the future. Critics say government is not a corporation, and mistakes in programs like Social Security have serious human consequences. And that brings us back to you. The success of this change won't be measured by internal memos or performance charts. It will be measured by lived experience. Do you get help when you need it? Are errors corrected quickly? Does the system feel more responsive or more distant? March 7th is not a dramatic flip of a switch for your benefits. It's the beginning of a long adjustment period. Some things may improve, some things may take time, some frustrations may still exist, even if the intention is to reduce them. I'll be watching this closely, and I encourage you to pay attention to how your interactions with Social Security feel over the next few months. If you notice smoother service, that's a good sign. If you notice delays or confusion, that matters too. If this breakdown helped you understand what's really happening, please hit the like button and subscribe to the channel. It truly helps more than you might think, and it allows me to keep bringing you clear, no panic explanations of changes that affect your money and your future. And as always, I'll keep covering this as it unfolds, because Social Security isn't just a program. It's something millions of people depend on every single month, and making sense of these changes together is always the goal.